Can you give us some idea of what your program looks like? What kind of things that people who come to you would get in that program? How it works, or the kind of steps it takes?
Yeah, so we're talking now generally about sex
Yes.
and porn addicts, not about those
Under
involved in
investigation.
offending. Yeah, so I always describe my work as being on two levels. One level is enabling clients to stop their behaviours at some point and getting to abstinence, and then move on into early recovery and then to build that recovery. The other level is trying to understand why the behaviour is there in the first place, and that's a whole different set of therapeutic support. As I mentioned before, it could be that the addictive patterns are a product of anxiety or depression or childhood experiences, traumas. I'm sure you've talked about many of these sorts of things in your other podcasts, but there is almost always a story behind the addiction. Very, very rare that the addictions occurred purely because somebody likes looking at pornography or they like messaging people online. There's something usually lurking underneath.
So would it be like a 12-step program that you go through, or something like that with them?
Well, there are some overlaps.
Okay.
In my work, I suppose you describe it broadly, if we're thinking about the stopping work, as CBT work. So we're working on changing behaviours, changing thought patterns, putting new routines in place, a new lifestyle in place. Whereas looking at the underlying aspects of it is more classic psychotherapy.
Can you give us an idea of what that kind of behavioural change would look like, CBT process? An example, just so people can understand it.
Yes, so let's take a porn addict, which is a very common presentation these days. A typical porn addict would be looking at 3 to 4 hours of pornography a day. It could be more extreme, could be way more than that. Depends on somebody's work situation, of course, and whether they have a family. So the behaviour change is really in enabling them to reduce or stop that behaviour, which we call acting out, and to put in place more wholesome, more healthy activities. They might take up exercise or a new hobby or join a new social group. So switching from unhealthy behaviours to healthy behaviours.
Yeah.
It sounds straightforward, doesn't it?
Yeah, it definitely is not.
I always say to my clients, it's simple work. The steps are very straightforward and clear and obvious. Doing it is not quite so easy. What they will struggle with are cravings, very serious cravings, resulting from withdrawing from a very intensive dopamine dependency over a long period of time. So a lot of the focus initially is on managing cravings. Usually that will involve engaging in some kind of distraction technique. So take up walking. I've had clients who have taken to online chess, or they've started meditating or taken up yoga. The list would be very, very long if I said what people found helpful as a distraction. But just doing something else when the cravings come on is a starting point.
Yeah. So they change that behavioural process into something that's productive instead of destructive.
Yes, but what they're doing, importantly, is reducing the amount of dopamine dependency and gradually bringing that level down over time. It could be, 5 to 6 weeks before they're really appreciating that they feel different. Some sooner, some a bit longer, but I find that's about the average. They're starting to get more in control, and the distraction techniques will come more easily.